Hi, I know IVF patients have lots of questions, and I know that IVF doctors don't always have the time or the inclination sometimes to answer all your questions. And that's what I'm going to try to do on this video channel. So feel free to ask me whatever questions you have. I'll be happy to do my best to answer them. And trust me, it's very unlikely that you're going to ask me a question someone else hasn't asked me before. So I think it's important that patients ask questions. I think it's equally important that doctors answer them and doctors share the information so that this information is then easily available for all IVF patients, and I'm happy to help. So, one of the common questions patients ask us is why are blastocyst transfers any better than day 3 transfers? And sadly, lots of patients don't even understand the difference between a day 3 and a day 5 transfer. And that's why I always tell them do your homework. You don't have to become an IVF doctor to understand all these basics. It's not very complicated. We take out an egg, that's called day 0. It fertilizes, that's called day 1. It continues to divide and grow. So on day 3, it's got 8 cells. We continue to grow them because our lab culture environments have become better. Good labs are better at being able to grow embryos to day 5. And we can grow them to day 5 quite comfortably, and that's called a blastocyst because it has a cavity. And a blastocyst has hundreds of cells, which is why it's so much better than a day 3 8 cell embryo. Its chance of implanting is far better because it can allow us to pick which is the best embryo, which has the most growth potential, which has the best chance of implanting. And that's why we recommend that all patients just do single embryo transfers, but these need to be top quality blastocysts. Please ask your doctor questions so that he can answer them. The worst thing is to be clueless about what the doctor is doing because that will come back to hurt you. So send me your questions. I'll do my best to answer them. Bye.